Coming soon to a body near you.
Inflammation.
Symptoms of inflammation include redness, heat, swelling, pain, and sometimes loss of mobility. However, not all 5 symptoms will always occur at one time. Pain is caused by the pressure of swollen tissues on nerves, and a dangerous complication of inflammation is sepsis. Damage to epithelium is what causes inflammation. Some causes include pathogens, external injuries, and effects of chemicals or radiation. Acute inflammation starts rapidly and results from onset damage, which can quickly become severe. Symptoms are usually only present a few days, but can sometimes last up to a few weeks. Chronic inflammation can be caused by several things. It can be a result of failing to treat whatever was causing acute inflammation, an autoimmune response to a self-antigen resulting in the body attacking itself, or a chronic irritant of low intensity that persists. One example is rheumatoid arthritis.
Inflammation is the body's attempt at self-protection, the aim being to remove harmful stimuli, including damaged cells, irritants, or pathogens, and begin the healing process. Vasodilation is what causes an increase in blood flow to the area. Vasodilation allows helper cells, the white blood cells, to come to the area and help fight the cause of infection. Chemicals are released to fight infection. Chemicals such as histamines, complement, and bradykinins are released, all which dilate arterial. White blood cells, such as neutrophils and monocytes, and plasma fluid rich in clotting proteins, antibodies, and other substances, seep into the injured area. Tissue trauma causes injured tissue cells, macrophages, mast cells, and others to release inflammatory chemicals, which cause the capillaries to dilate and become very permeable. White blood cells, such as neutrophils and monocytes, and plasma fluid rich in clotting proteins, antibodies, and other substances seep into the injured area. The leaked clotting proteins construct a clot which stops blood loss effectively. The leaked clotting proteins construct a clot which stops blood loss and effectively walls in or isolates the injured area, preventing bacteria, toxins, or other harmful substances from spreading to surrounding tissue.
After response, excess fluid, bits of destroyed cells, and debris are removed. Hyperemia is the congestion of blood that causes redness and heat. Edema is the swelling of tissues which causes pain. Water which comes from the surrounding blood vessels accumulates. This occurs because the blood vessels become more leaky. Edema is often a good thing because it causes a surge of protein-rich fluids to flow into tissue space. Immune systems of older people often have sustained low inflammation. Because of this causes chronic inflammation of the elderly.
Inflammation in joints often causes undesirable conditions. Some of these undesirable conditions include bursitis, tendonitis, arthritis, and Lyme disease. Tendonitis is an inflammation of tendon sheaths typically caused by overuse. Symptoms of tendonitis include pain and swelling at the site of discomfort. Bursitis is the inflammation of a bursa and is usually caused by a blow or friction. For example, falling on one's knee may result in painful bursitis of the prepatellar bursa.
Asthma is a condition caused by the airways becoming inflamed, making it difficult to breathe. Rheumatoid arthritis causes many joints to become permanently inflamed. Symptoms include pain, stiffness, and swelling of the gingivitis is caused by inflammation of the gums. There are various treatment options available for people with conditions that are caused by inflammation.
Anti-inflammatory drugs help treat people either by getting rid of pain associated with the inflammation or by blocking the synthesis of prostaglandins, which causes inflammation. Types of anti-inflammatory medications include non-steroidal anti-inflammatory drugs, acetaminophen, and corticosteroids. There are many natural and herbal remedies that people use to combat inflammation. One example is ginger, often being used to treat gastrointestinal problems as well as rheumatoid arthritis pain. Tart cherries also have powerful anti-inflammatory properties that help many who suffer from joint pain and arthritis. Applying ice to a source of inflammation is yet another treatment for inflammation commonly used, with the ice being wrapped in cloth before directly touching it.
Hey guys, why are inflammation sites always so red?
I don't know. Why?
Well, you'd be blushing too when you're constantly surrounded by compliments.